Hey folks, it's Chuck with Homestead Medical. Welcome back. Today we're going to continue our series on layers of our medical protection, our medical everyday carry, our layers of medical preparedness. So today we're going to discuss EDC, our everyday carry medical. Something we should carry on body. You should have medical with you at all times, not 10 feet away, but essential items that could kill you in 5 minutes or less. We should have those on us at all times. Now, whether you carry a firearm to protect yourself and your family, whether you're on the homestead, you're running a chainsaw, you're doing those daily activities you have to do to take care of your property, your home, whether you're at a sporting event with your kids, accidents happen, things happen. We need to be prepared for that. And medical should be something that you have with you at all times. There's no excuse. Don't make the excuses. A lot of people make the excuses. Oh, it's too much, it's too big. I get it, but it's not. It's very easy to carry. So let's be prepared. Let's have those things. Our first step is we should have had our training. And we talked about that in an earlier video. It's the first step of medical. All the gear is useless unless you know how to use it. Second, we have to have that prepared mindset, that medical mindset of preparedness, that we're going to do a survey. We're going to triage our needs, and it's mission specific each time that we go out, what type of medical kits we have, and we're going to have layers of that preparedness. So first thing we should have, tourniquet. Whether it's a Cat Gen 7, it's a soft T, or even the TMT tourniquet. But we should have one, a windlass tourniquet for those arterial bleeds. You get an arterial bleed, 90 seconds, you're going to lose consciousness. After 3 minutes, you bled out, you're dead. So have this tourniquet on you. But we don't always have those arterial bleeds. Relatively, that's a low percentage injury that you're going to have an arterial bleed of an extremity. So lacerations happen, right? We want something that we can dress a wound, stop bleeding, put pressure on it, carry a pressure bandage. Now I get it. A lot of people say, oh, we don't want to carry these big Israeli bandages. It's too big. I don't want to carry that on my body. This is a pressure dressing right here. This right here is a mini compression bandage by H&H Medical. It's very simple to use. It's thin, small, slip it in a pocket, a back pocket. You can carry it with you anywhere, your purse, whatever it is. But to go with that, we should have wound packing gauze. So wound packing gauze that we have a large lacerations, we have a very heavy venous bleed. We may want to pack that wound to get that bleeding stopped, and also to protect that wound, keep the contaminants out of it, try to keep as much bacteria out of it that isn't already in it. Because once you open that skin, you have that laceration on your body. It opens up. Your skin is your protectant. It's what keeps that bacteria, the dirt, all those things out of your body. But once you create an opening, bacteria is going to get in. So we want to pack a wound. So wound packing gauze, relatively small. It's not a lot of stuff. You can carry that in a pocket very easily. Other thing we want to talk about, gloves. We want to have gloves because if it's not our blood, it's not our family member's blood. If it's somebody else that we may be in a position where we're going to take care of, we want to protect ourselves at least with this pair of gloves. Look at this. Small, compact, very easy. So going on with that everyday carry, the other thing, penetrating chest wound, sucking chest wound. You have that air that starts to enter the pleural cavity of your body. That air starts expanding in that space. And what's it going to do? It's going to compress your lungs. Your lung on the side, the affected side of that injury, it's not going to be able to inflate all the way to breathe. So it's going to press that lung, and it's going to press it to where? Against the heart. Then it's going to affect the heart and the other lung. It's no good. 5 minutes, you could be dead. So we want to carry a chest seal. Cover that. It's vented. So that way we're not allowing any more air in there. You're going to save a life. Other thing is, we want to protect airway, right? We want to keep that person. If that person is unconscious, unresponsive, we don't know if they can actually protect their own airway. So if they're breathing, we want to do a nasopharyngeal airway. Small again, thin, easy to carry. So we're starting to amount a lot of stuff. What do we do? How are we going to carry it? Those of you who have been trained in needle decompression, that we're going to have to insert this needle again to remove that air out of the chest cavity. have a needle. It's pretty small, right? It's a lot of stuff, I know, but how do we carry that? How do we put that on there? Well, if you're wearing pants, easy thing to do, ankle kit. Goes right around. You have all these things in it. Everything I just showed you, it's in here, along with a pair of trauma shears. So I have all this, put it around my ankle, pants leg goes over, it's fine. Probably not going to wear it with shorts. Hey, but if you want to, you do you. Or you can do it in a small little kit like this. This wasn't designed to carry medical. This is a special operations equipment pocket organizer. I looked at it at John's and I thought, you know, you can turn that into a small kit. All those things I just showed you, there's a full IFAC individual first aid kit all right here in a small little thing. I carry this. This is the one I carry with me daily if I'm not using the ankle rig from Special Operations Equipment. Same thing, and I'll put links in the description. Best equipment made, unless you're getting something from Combat Art Training, who also carries a pocket kit, which I don't have yet. And Andrew, you better send me one so I can show you all these fine people your stuff. Andrew makes exceptional gear. I'll put a link to his stuff in also, but there's no excuse not to carry these things. There's no excuse not to be prepared. So if we're going to be prepared, we're going to have these things, training, mindset, and now we're going to carry it on body so we're ready. So all of that things I just showed is in here along with duct tape. Why duct tape? Because duct tape fixes everything. Now I know you're going to say, well, you know, I've got little kids and I want to carry stuff with them. You know, I don't have a tourniquet, a cat tourniquet or soft tee's not going to fit those small kids. You're right. It won't up to a certain age depending on their size. So what do? Found this Slishman wrap. Now, this can be used as, and you can see the compactness, but look how big this gets. And then we have this great piece of equipment that we can put around a child's arm. We pull it tight and then we wrap to occlude that bleeding, right? We want to stop that bleeding. The other thing is, what if we don't have this stuff? You haven't been, well, here is, it's a pressure wrap. That's what it's called. You can wrap it around 4x4s, whatever, something you put down, make an improvised bandage, and then you can use this as your pressure dressing if you're not going to use it as a tourniquet. But here's something that you can fold up small, as you saw when I picked it up, very compressed, stick it in your pocket. It can also go in this kit. SOE pocket kit, I think, is a pocket organizer is a great little thing. It has pin slots made to hold notepads. I've got my chest seals here. I've got my needle here. And inside, I've got my pressure dressing, my wound packing gauze, my nasopharyngeal airway, and some duct tape, and a pair of gloves. All of this is right here. You could easily, there's plenty of room, you could stick a pair of gloves back down in here if you want it. And you can also put a pin and stuff if you want to document what happens. But all these things are right here, easily available. There's no excuse not to carry everyday medical. There's no excuse not to be prepared. If you're just going to say, oh, it's too much stuff, I don't want to carry it. Why? If you're carrying a firearm, you're carrying a spare magazine, you're probably carrying a knife like every man should. You're carrying all these things. Carry the freaking medical stuff. Carry a freaking tourniquet. It's not hard. I carry this in one pocket, this in another pocket, cargo pocket. I'm ready. I can take care of any emergent need. And this layer, this is what's going to get me back to a bigger medical pack. So I can go, which we're going to discuss later on. Our EDC everyday carry is going to be done in 2 stages. I'm going to do a follow-up video for other individual IFACs in different types of settings that we're going to be carried. But this just gives you a quick little glimpse of what you should have, why you should have it. It's important. How much is your life worth? What about your spouse, your girlfriend, your husband? What about your kids? What about the people you with, your loved ones? People you're around, your team. You should be carrying this. Be responsible. Be an adult. Be ready for what throws at you. So I'm going to put the links of Special Operations Equipment and Combat Art Training, their equipment, down in the links. Please like, subscribe. Please share this if it brings value to you. You want to discuss how to build an EDC medical kit, I can provide you with all the equipment to do so. See you soon. We'll train together soon.